The 1+MG genome initiative brings together European member states and Norway in order to advance research and also access to genomic linked with clinical data for the benefit of patients, of citizens and healthcare professionals. The aims are to create a secure data infrastructures that bring together the clinical and genomic data linked together from all the member states and Norway, and also giving the possibility and access to clinicians in every hospital to access this data in a secure manner, because the data are stored at the national level, but the federated model allows for everybody to access at the European level. So the data that will be stored in the infrastructure comprise genomic data. So what is genomic data? It's the data that are taken from one unique DNA. So it's about hereditary. It's something that can be found in the blood or can even found in saliva. So it can be also very simple to collect. And once you have this information, you can really make personalized medicine, which means that you can use a drug specific for a specific disease, thanks to a variant that is inherited, but also thanks to variants that can be detected in the tissue. Let's make the example of cancer. So you have the tumor tissue, you can take also the DNA from tissue, because the DNA from the tissue can differ from DNA in the blood. And so these two levels can be very informative for the clinicians in order to identify the right drug for you. Since when the human genome has been sequenced almost 20 years ago, the healthcare has lived a revolution. So personalized healthcare is a reality, especially in terms of treatment, but not that much in terms of prevention and not even in terms of early detection. So 1+MG initiatives definitely will foster research and application in clinical setting of personalized healthcare. First of all, I think that those who will benefit are immediately the patients. So the patients with cancer, patients with rare diseases, patients also with cardiovascular diseases. Actually, until let's say 10% of chronic diseases have an inherited fashion. So they will definitely benefit. But it's not about only patients, it's also about citizens. Because in principle, also the prevention can be more personalized, taking into advantage the genetic background. There are a number of studies that reports how people can change their lifestyle based on the knowledge about their genomic setup. But it's not only about citizens and patients, it's about healthcare professionals, it's about also the industry. They can advance more research, they can also develop new drugs. So overall the benefit will be for the society, but also for the healthcare system in general. So healthcare system can benefit in terms of resilience, especially for people who need a diagnosis for a rare disease and for people who need a target therapy for cancer. In terms of prevention, we still need some evidences, but the promise is that eventually also healthcare system can be more resilient when the prevention can be more personalized. Researchers like me will definitely benefit having the access to genomic and clinical data together. So far we were only relying on individual epidemiological databases, but once you have thousands of data together, you can definitely also spot very limited and small high group population that can benefit from treatment or also from early diagnosis or screening. The 1+MG initiative also have the potential to impact in a very positive way in terms of economic growth and job occupancy, because we have bioinformaticians and technicians that work at the interface of healthcare, but also biotechnologists, and these kind of occupations were not that much present at European level. So I think this will definitely increase, and I think it's a very good thing. In research hospitals, it's fundamental that citizens participate, because eventually this will benefit them once they will be sick. And at some point, everybody will be sick, unfortunately, in life. 1 over 5 people will develop cancer in the lifetime. So 25% of citizens will develop cancer and they will benefit. So I think that it's important that citizens, of course, are aware of the benefits and the potential challenges when they sign the consent, and eventually they can always withdraw. But I think this is really the last situation. We should not even consider when we engage in research. We should think that we're doing our best to help others and to help also ourselves. The access to this genomic and clinical data is completely under strict control. Only special people, like clinicians, like researchers, can have access to this data. Italy was one of the first countries signing the 1+MG initiatives when the countries were only 6. So we did believe since the beginning, thanks to the engagement of the former Minister of Health, about this important initiative. After that, what we did as a country in order to advance, we participated to a number of initiatives at European, but also at national level. We created the national mirror group of the 1+MG initiative on ethical, legal framework, initiatives on research, initiative on industry. There are actually 12 mirror groups in Italy, and the last one is about pharmacogenomics, because in order to advance at the national level, we need all the working group with experts advancing at national level the implementation of this initiative. Thanks to the 1+MG initiative, the 12 mirror groups were able to update the national strategy for genomics, thanks to a funded project from the Italian Ministry of Health. And secondly, in Italy we have an initiative which is called Health Big Data that joins together only the research hospitals. Only clinical data are there, however, while thanks to 1+MG initiatives, also the genomic data will be started to be collected. So I think this is very important for our country, for researchers, but also for patients.